we're going to bring in Dr. Siegel right now, Fox News medical contributor, here to talk about some of these key issues as they relate to coronavirus. Dr. Siegel, welcome back as always. What do you make
Good morning.
Good morning to you. What do you make of the impact of these ships, the Mercy, the Comfort, and what kind of effect they will have in terms of the ability of these hotspots to deal with the disease?
Well, first of all, as the president just said, the United States Navy ship Comfort, a 1,000-bed hospital with 12 operating rooms, ICUs, radiology suites, labs, 5,000 units of blood, is going to bring here a spirit of courage, the United States military, of hope and assistance. And it's going to mean that non-COVID patients, patients that don't have this virus, will be able to get traumatic services, emergency and urgent surgeries and care outside of the hospitals of New York City, which will free them up, Jedediah, to focus in on not just care for the virus patients, but to separate them out properly, to observe proper infectious precautions, and to get our healthcare workers properly outfitted. That will take a tremendous amount of pressure off, and we're all going to be inspired to see the ship come here to New York tomorrow through New York Harbor.
Yeah, can I just ask one follow-up question, Dr. Siegel? Pete had asked this question earlier to another guest about the concern that someone with coronavirus could potentially get on one of those ships. Obviously, those ships are designated for non-coronavirus patients. Do you think they will adequately be able to prevent that? Because that's my first thought, is that somebody gets on there, has unclear symptoms, has not had a test, gets into the ship, and then suddenly you have coronavirus spreading on the ship. That would be a huge problem.
There's two things that come to mind. First is the word triage. They shouldn't be bringing patients to that ship that have viral or respiratory or symptoms that could be coronavirus. It should be for things like broken bones, for surgeries, not for that. The second thing that's related to that is I really want this rapid point of care test in place that Abbott has made, where we literally can test people within 5 minutes and decide if they have it or they don't. We need widespread use of that right away. That will help.
Can't get on the ship until you take it might be a way to do it. Yep. But their news yesterday was that potentially the president may take a step to do an enforceable quarantine of New York, New Jersey, and Connecticut. Later in the day, the president clarified. Here's part of the tweet that he sent out about the move they're making. He said, on the recommendation of the White House Coronavirus Task Force and upon consultation with the governors of New York, New Jersey, and Connecticut, I have asked the CDC to issue a strong travel advisory to be administered by the governors in consultation with the federal government. A quarantine will not be necessary. The CDC followed up with more direct guidelines, and this is what it says, that due to the extensive community transmission of COVID-19 in the area, CDC urges residents of New York, New Jersey, and Connecticut to refrain from non-essential domestic travel for 14 days, effective immediately. Doctor, your reaction, is a travel advisory right now the right way to go, and what impact will it have?
I think it's hugely important, Pete, right now, when you consider that there's 52,000 cases in New York State alone, and that also has additional cases in the outlying areas, what we call the tri-state area, New York, Connecticut, and New Jersey. We need to clamp down on travel and really restrict people staying at home, sheltering in place, very careful travel for only essential means. But we need it for essential means to keep what's left of our economy going. So it's important. I think the right decision was made. Strict travel advisories, and I would urge everyone who's watching us to follow them, because we don't need more cases right now. Our hospitals here in New York, for example, are completely overwhelmed.
Well, Dr. Siegel, all our viewers certainly appreciate what you and the other doctors have been doing, which is answering the questions from our viewers. Let me read you an email we got from Dan and see if you can answer this and help him out. He says, is it true increased indoor humidity can decrease coronavirus transmission?
You know, that's an excellent question, Griff. And there was actually a study from the CDC, Centers for Disease Control, back in 2013 that did show that humid air indoors decreases how far respiratory viruses can travel. So I think it's a really good idea that you have humid air, a humidifier in your house right now. It's not a cure-all, but it's a very positive step. And we're also hoping that warm, humid air outside will also decrease the spread of this. We're hoping that spring will bring hope in that regard.
We also have a question from Elizabeth on Facebook. If people are smoking or vaping, does the smoke they exhale carry the virus?
So that's another excellent question from our producers. I don't think so, but I'll tell you something. I'll tell you why I don't think so, because it's not airborne. It's a respiratory droplet, so it shouldn't travel on vape or smoke. It's respiratory droplet only. It's not hovering in the air over you. But I want everyone out there to know that vaping and smoking damages your lungs in ways that make it more likely that you would have a serious case. Now is the time to quit. Not tomorrow, now. It will help if you, God forbid, get this, you would likely have a milder case.
Doctor, one more quick question. Email from Jack says, can the new 5-minute test you talked about, doctor, for COVID-19 be adapted to the drive-through process so people find out right away?
You know, I will be talking to Admiral Giroir from HHS about that this week, and I am hoping the answer to that is yes. I'm certain they're going to be doing more rapid testing. Those 5-hour lines with the big nasal swabs, now it's a much thinner, easier to use swab, and the results in 5 to 13 minutes should definitely be used on those mobile units, definitely, and will cut down dramatically. Those tests can do 50,000 patients a day. That's what we need here in the United States right now. That will help us to separate people out who have COVID-19 from the general population. That will help to squash this.
Dr. Marc Siegel, thank you so much for your time this morning, your expertise. We really appreciate it. Great stuff for our viewers.